My name is Drake Green. I'm a 31-year-old severe bleeding hemophiliac. I was diagnosed before I was born, and when I was about 4 years old, my family decided to move to Peoria. Dr. Tarantino was a big reason for that, and I think my parents made a wonderful decision. They didn't want me to live a restricted lifestyle, and making sure I got the right care by the right person is critical to that. As a hemophiliac, you're often treated a little bit differently. You're treated a little more fragile than the average child. Right off the bat, from the physical standpoint, you have a central line. I had 5 growing up. They've moved them around, but essentially it's a line hanging out of your chest that you have to tape and retape every single day. And if you would go to a friend's house, the parents had to be educated on your condition, which ultimately led to you being treated different. I was about 12 or 13 when they started teaching me to give shots. The nurses allowed me to actually stick on them to practice. That is allowing yourself to have that pain so a child can get that care and that education was huge to me. I really give my parents a lot of credit. I can't even imagine having a hemophiliac child. To cause your child pain is not something that's enjoyable. So to get through that is really tough. I went from giving a shot every other day to once a week now, which has changed my life dramatically. From a young age, I did a lot of sports, soccer, swimming, tennis, baseball, basketball, and golf. 2 years ago, I ran a half marathon. That was questionable with my care team, whether that's too high impact. But with proper training and doing it with the right prophylactic schedule, it does work, and you can succeed and live a very healthy lifestyle. You don't have to be limited, and if you know how to treat your condition, you don't have to be afraid. You need to be your own CEO of your health, and BCDI empowers that right from the beginning. You need to be educated about your condition so that you can tell others, because sometimes you might end up in the emergency room and the nurse doesn't know what hemophilia is. They don't necessarily know what medication to give you, and that could be a life-threatening situation. We have different programs here at BCDI that allow you to go through different providers all in one day. We call it the comprehensive clinic, but you're working with a social worker that day, with a physical therapist, with a dentist. You have different nurses that come through, physician's assistants, so you're very well taken care of. And then I've got to give Dr. Tarantino the most props of all, because he will take the time to explain extremely complicated issues to make sure you can be that CEO of your life. As a young kid, I remember being in those hospitals, getting the Metaports removed and inserted, and he visited me at the hospital. He talked to the doctors. I felt completely confident that the surgeons knew what to do because Dr. Tarantino was there for us. Honestly, the insurance network is sometimes challenging to navigate, and without that, you could be hundreds of thousands of dollars out of pocket, as my parents were when I was younger. But now most of my medication is fully covered, and that's thanks to the team, and they help me navigate that. And if your medication's not quite right, they make sure you get the right dosage. Places like BCDI make a huge impact with getting people the medication and preventatively treating rather than reactively treating. My grandfather had the condition. That's how it was passed down through my family. And he had many joint bleeds and things like that that crippled him for life. But also, just before my generation, the medication sometimes had bad batches, and that led to HIV and AIDS for a lot of patients, and people would look at hemophiliacs different in that era. We've moved through that, and with education, better medication, people can live a normal lifestyle and not feel like they're different. Traveling 3 hours for care, a lot of people can't quite do that. So having this here in Central Illinois is essential. I think we need to be proactive in the community by going out there, educating people on different conditions, so friends and family can recommend, hey, maybe you should go get checked out. So first off, thank you to the BCDI staff. You guys are wonderful. You make the mission possible. We do need to keep up the support so we can continue to educate the community so that people like me can live a normal lifestyle, be educated about their conditions, and continue to live active and unrestricted lives.